God morgon från Paretodesken. Det är tisdagen den 15 november och veckan inledde på minus på Wall Street-börserna sjönk i kontrast mot förra veckans lättnadsrally efter att inflationssiffrorna kom in lägre än väntat. S&P 500 stängde igår på minus 0,9%. Och innan vi kör igång dagens samtal, vi ska prata Calliditas idag som släppte rapport igår, så vill jag påminna om att Calliditas är faktiskt ett av bolagen som vi har med i vår Selected Small Cap-portfölj. Vi släppte ju en uppdatering av vår småbolagsportfölj igår. Och på torsdag kommer vi ha ett digitalt event där vi kommer gå igenom portföljen och där 6 av bolagen i portföljen kommer presenteras. Så passa på att ställa frågor till oss och till bolagen där. Ni kan anmäla er och lyssna in i efterhand också, men då måste ni vara anmälda via länken. Jag kan länka den i beskrivningen. Ja, som sagt, Calliditas Therapeutics är ett av bolagen som vi har valt ut som ett av våra favoriter inom småbolagsuniverset. Calliditas kom med rapport igår och idag så kom de med nyheter om de kom med nyheter kring deras kinesiska verksamhet. Så jag säger god morgon Dan Akschuti. Berätta.
Yes, so just today, actually, if we just mention that first, they announced that the submission to the Chinese FDA basically was accepted by their Asia partner Everest Medicines, which means that we expect a potential approval by later 23, so sometime within the second half of 23. Which then would open up the Chinese market, where we see around an addressable market of around 5 million patients, which is very large, but the pricing is obviously different, and China is always a bit, it's very difficult to assess, and drug sales usually don't pick up that much there, so that's why also we didn't value it, and we won't value until it's launched, but it's still just additional upside for Calliditas.
Och hur var rapporten igår då?
Yeah, and the report was very good. So we expected, based on peer drug launches, a bit more sales. So we really believe there is more is possible. And we discussed that in the initiation report and also some other releases why we believe that. And Calliditas has also realized that in Q2 when they decided to increase their sales force by 50%. To a total of 60 FTEs, which those were only trained in Q3, so they will start being active now in Q4. Still, the company has reported $12 million in sales in the second full quarter, which is, I would say, still a lot for a small Swedish company launching a drug by themselves in the US. And overall, we can really see that the sales are increasing. They had an additional very good peer-reviewed journal article that came out, which also they mentioned in the call was quite important for many doctors to be comfortable when prescribing the drug to their patients. Currently, as of end of Q3, they had 730 patients enrolled, and that the reimbursement rate of 80%, which is very high, and that high reimbursement rate really secures the market potential. And the enrollment that we see, and currently 480 unique prescribers as well, that kind of ensures also the growth in Q4 and also going forward. And in Q4 also the sales in Europe will start, where Nefecon is sold under the brand name Kinpeygo by Stada, and they started in Germany, where the retail price was around 82,000 euros, which after discounts etc. ends up at our estimated price of around $70,000 per year per patient. So very good development. So there's really nothing going bad somehow. It's just that they could do more, but yeah, it's a comparison to bigger companies, to companies that burn much more cash doing so as well. But I think there is a blockbuster potential here, meaning that the drug should be selling at one point for over $1 billion, and that needs to be catalyzed early on. So they only reached to date around a bit more than 10% of the prescribers in the US. So I think it makes more sense to actually have a big sales force from the start and not gradually increase it, especially since they are first to market and the market needs to be built in a way. There has been no drug approved, so there are lots of prescribers also that maybe look not that important, because there are differences between prescribers. Some will have many more patients than others, but if you're first to market, some of these prescribers will look maybe as if they're treating less patients than they really do. And that will only reveal itself after a first drug has been launched. And I think that's why they should probably do a bit more there. But either way, it's developing very well. And COGS has also been very lower than we expected. That the gross margin was higher than 96%, on 96.5%, so very high gross margin. We also adjusted the EBIT margin as a result of mainly that for the next years. For 23, for instance, from 37% EBIT margin, we increased it to 41 based on these realities, and that's partly because the drug is very cheap to produce and it is very expensive, and the price of course comes here because of the expensive development of the drug, and that's not per se a unique thing for Calliditas. That's often so that drugs have very good margins.
Tack så mycket Dan, och tack så mycket för att ni har lyssnat. Glöm inte att anmäla er till det här eventet. Det är öppet för alla att anmäla sig, och det kommer bli en genomgång av portföljen och spännande bolagsdragningar på torsdag. Anmäl er redan nu. Tack!